right, that's great. If you can just make that full screen, that'll be, there we go. Perfect, Joel. I will see you in 20 minutes with some questions. Thank you.
Wonderful. Thank you, Sean. So first of all, thank you very much for inviting us here. Today, we're very pleased to be here, and I've really enjoyed the presentations so far. As you've just heard, my name is Joel Ratnasothi. I'm Chief Executive at Interneuron. Interneuron is a health and care technology company that was set up to solve some of the more tricky problems I think the industry faces. But before that, my background is clinical medicine. I was a doctor and surgeon and worked as an academic in the NHS. And I've seen this particular problem from a number of different perspectives. And I think it's a deceptively simple one, which I think still hasn't really properly been solved. So it's good that we're still talking and trying to collaborate in solving this. I think just first to quickly do some definitions. Patient flow, as I'll define it, is the movement of a patient through a hospital. And it's important to sort of recognize that's all of the activities that happens to a patient, both administrative and clinical, from admission to discharge. And indeed, you know, we heard about some pre-admission activities as well. But if I'm going to focus on just admission to discharge for this part of the presentation, the data we're after is largely operational. So we're looking at operational data to help us measure patient flow through the different pathways that run through the hospital. But one of the points I would like to make, and the message I'm going to try and reinforce in this presentation, is that a lot of operational data can be derived from clinical data. So where we have application software, modules, devices that are supporting clinical care, if we can work with those and integrate them into a core platform, it is then possible to power patient flow applications that can provide us with operational views of data as a patient progresses through their admission. So why measure patient flow? So I'm going to just quickly come back to this through the presentation, but there are two basic questions here. Where are my patients? And then if there are problems, why are there? Why are there delays? Where are my patients sounds like a really simple problem to solve, but for anyone that works in a hospital, and certainly from my days as a junior doctor, you might know where your patients are at one point in time, but as your ward round progresses, particularly if you're on a very long medical ward round, you've got no guarantee your patients are going to be where you thought they were. And so simply keeping track of where patients are is really important. And patients will be moved for many reasons. You know, some are good reasons. They might have a change in their deterioration of health and need to have higher acuity care, but they might be moved towards purely because of operational demands, medical patients on surgical wards and vice versa. The second point then is, why is there a delay? So if it's all very well to measure patient flow and understand issues with flows of patients on a particular pathway, but if we don't understand why there are delays, we don't understand the reasons for those delays, it's going to be very difficult for us to complete any quality management cycle. What's the intervention that we're going to do as a result of understanding current status of patient flow? How are we going to improve things? And so that's really the second point, and links, as I hope I'll argue today, with the need for an insight into the clinical data. So just to define a patient pathway, obviously patient pathways are very different. Patient pathways vary hugely from medicine to surgery, from even within medicine, from respiratory to gastro. There can be lots of different pathways. However, there are general hooks, we can call them goals, that are always present regardless of the pathway. Patients are admitted, diagnosed, treated, they recover and are discharged. And while this isn't by no means a linear path, and there will be loops going back, these are hooks that we can use to focus our attention on pathways in general and start to glean information around how long someone waits before they're admitted into total length of stay. There's of course information that we're already collecting. We already have to collect about our patients. So hospitals are required to produce information both internally and externally for our targets to length of stay, bed occupancy, other quality of care metrics. And these are, it's important to understand that while these are hugely important, in isolation, they don't help us truly understand patient flow. And we need to understand how, for a particular patient, their weight and the metrics across the patient pathway are affecting the flow in general. So the second point is we're sometimes asking our organizations to measure these in addition to what we're currently doing. So we're all really currently doing the administrative and clinical tasks. What we really want to understand, what we really want to do is take the data that they're already generating from providing frontline clinical care and try and derive some of this data from that. So we're not asking our organization to do more work than they were originally. So how can that be done? So if patient flow as a concept lives above or can be derived from various different clinical activities, there are a number of points where I think we have solutions, or there are digital solutions that can drive this data. Assessments, both on admission and at various points throughout a patient's stay, can tell us lots of information. Decisions to admit, or indeed admissions themselves, whether a patient has been assessed for VT assessments or other quality metrics. We know where the patient is, we know when the patient was there, and that data can be derived. Fluid balance, it's an important part of clinical care and clinical assessments. We know if a patient is deteriorating, we can diagnose things like acute kidney injury from proper fluid balance management. If a patient has a drain in, they're more that we can infer that they're post-operative. If they haven't had their drains removed, we can infer they're not likely to be discharged at any time soon. So there's data that can be derived from clinical data that we can capture digitally, or we already are capturing digitally. Similarly, observations. I think the NEWS early warning score system is a good prognostic indicator of a patient's current status and risk of deterioration. Again, coming back to understanding why there might be delays in patient flow. EPMA, electronic prescribing and administration. The patient may be admitted for a particular course or therapy. Has this happened? Are they receiving their medications in a timely fashion? Is this another reason for delays? And of course, generating a discharge summary and timely hospital discharge is often, I think, a key or an important factor when trying to understand the overall progression of a patient through a hospital. So how does Interneuron get involved? Interneuron has developed an open modular care record. It is open in the sense it is open source, we have open API, and we are able to integrate with numerous different systems. What you're seeing at the moment is our modular care record. We have our patient flow command center at the top there that is fed by our individual modules. We have an assessments module, which, as I said before, can capture data at various different points within the pathway. Fluid balance, observations, electronic prescribing, and discharge. All of these modules fit within a common framework. People visit the care record. They can identify the cohort of patients they're interested in, be it by consultant, by ward, by specialty or team. And then the only part that then changes is the module that they're interested in. Now, our platform, as I said, is very open. We can integrate with other systems. You probably already have digital systems collecting this data. And in that sense, we can just integrate it with data that you're already collecting, which then, as I said, drives our patient flow control command center, which sits at the top there. So regardless of how mature or not your organization is, you're able to, the point I'm hoping that coming across here is that using your existing clinical data is a really important source of operational data that can help measure and monitor patient flow. So just to reinforce then what I was saying at the beginning, irrespective of the patient pathway, be it surgical or medical, there are various hooks where these modules go in. These are modules that are used and created specifically for acute organizations, but they can be, they're not specialty specific. They're just as applicable in surgery as they are in medicine, in particular types of surgery as they are in particular types of medical practice. So I'm going to just pause there and just take a little bit about Interneuron. So Interneuron has existed for the last 5 years or so, and we've been created as I said, as a very open organization. We're trying to solve some of the thornier problems the industry has, and we're open in 3 senses. All of our source code is open source. We have open API, which means organizations that use our systems have complete access to their data. The data does not belong to us. We make it very easy for analytics and academics to use the data with the appropriate governance and role-based access control. But lastly, we are open in the sense of our business model. We're a community interest company. We are not for profit. And part of that business model is designed for longevity, where we, over time, are looking to improve the nature of our modules, where, with respect to patient flow, there'll be areas where we need to collect data that we don't have a module for, or that is very peculiar to a certain organization. And because we've built a framework in a very standardized way, it's relatively easy for us to add an assessment of a certain type in a certain place, or create a new module to capture data at a point in that pathway, so that you can really get the metrics that you need to monitor patient flow, but as I said, also understand why there are delays or why there are problems with patient flow in the first place. We have been fortunate enough to be recognized for some of the work that we've done. We were successful in being finalists in the HSJ Awards last year, and we won the Health Tech Team of the Year with the Royal National Orthopaedic Hospital last year as well. Lastly, and I realized I've maybe gone slightly faster, so I probably have time just to show you. We are, again, are very open in the sense that we want to share and show as much as possible. So please do get in touch if you want to understand more about what we're doing and make an appointment. We would be happy to demonstrate our product. But if you are too busy and you just simply want to see what we've done, you can visit modularcarerecord.com. And in fact, I will just quickly pull that up now. You can see this is a playground of our environment. I can't vouch for the quality of data that will be in here, because people can visit the site and use it, but you'll be able to see both the command center and how you can navigate through different wards in our virtual hospital for the patient flow module, and the modular care record itself, with the different modules that you can go through by picking up the top left here. So that's observations, fluid balance, electronic prescribing, and so forth. So I have finished, I think, with a few minutes to spare. So Sean, if you are there, I think I can take some questions if they're forthcoming.
Hi, Joel. Yeah, thank you for the presentation. Absolutely brilliant to have a little look under the hood of what you and the team have been up to. Yeah, we have got a few questions, just to let everybody know that the poll is now open on the screen, so please do get involved if you fit. So, Joel, Sarah's kicked us off here with a question. So, when you mention open MTR, integrating systems already in place, does this create a central data input point instead of using different systems to input data?
You can, yes. So you can add data directly to the modular care record, but most organizations live in a mixed economy, call it. So where you're already entering data somewhere else, we can integrate that so that you have one version of the truth.
Perfect. Another question here by David. Can you discuss the implementation process, clinical downtime, question mark?
Absolutely. It very much depends on the module. So if you have all the clinical modules in place, you already have the frontline staff using digital systems by other parties, there'll be no downtime. We'll be able to integrate with those systems, and we'll be able to provide that patient flow view for whoever needs to see that. Obviously, depending on the module, there are various elements of predominantly training and clinician training that's important before you go live. So we went live with observations, the module 3 years ago now. It happened over a weekend. We've gone with the very standard user interfaces. So for the observations module, we picked the Royal College of Physicians standard news to chart. This was recognized by most users, so training wasn't a problem. That's obviously something like electronic prescribing. There's a lot more training. There's a lot more of work that needs to be done. So it very much varies with the module.
Absolutely perfect. And did you capture patient data, or did you just use your experience of working within the NHS? development?
Say that once more, Sean.
Did you capture patient data in these development stages, or did you just use your time and experience from working within the sector?
So obviously I've brought a lot of my experience to bear in terms of the vision of the product, but the product specifically we've co-designed with the NHS. So the Royal National Orthopaedic Hospital has been instrumental in working with us and using their experience and data to help design and validate the vision that we've set out.
Absolutely perfect. And lastly, do you provide on-site demonstrations? And if so, how would we go about utilising that? Please
get in touch. We'd be happy to arrange that. You can understand the modules from the open access portal that we've created. It would be relatively, again, it depends on the module, but it'd be relatively easy for us to come on site and provide a demonstration for you. Absolutely brilliant. Well, Joel, absolute pleasure. Thank you for joining us today. We have been asked about the slides as well. Can we get those shared post-conference? Is that okay? Of course, yes. Absolutely brilliant. Well, Joel, absolute pleasure. Thank you for joining us today and look forward to seeing you again soon. Thanks, Sean. Cheers again now. Have a great day.